How are you doing today? Great. Good. Thank you so much for being able to come out. Such short notice, kind of put this together last minute. I'm just glad that everyone, we had as good attendance as we did. It's just, I know that this was shared a lot from the Republican County page here in Cherokee County, but I do not want this to be a political event. This is I just felt like it was an opportunity to co-host with Love Life Christian Center and to be able to give the community an opportunity for a little bit of education on another opinion for COVID-19 and the mask mandate that's been proposed, that was discussed Monday night from the City Council. So I thought this would be a great opportunity for everyone to be able to just hear another side of that, hear a medical opinion in this whole debate. And so, like I said, I do not want this to be a political or a partisan event. This is just an event to get education to all sides of the community, and that's something that I'm very proud to do. I'm proud to engage with Tahlequah, and I'm so glad that everyone came out on such short notice. This is a great turnout. Can't thank you enough for being here. And in that, I'm going to go ahead and give an introduction to our guest, Jim Meehan. MD champions honest science deployed to create genuine health. He has advanced training and experience in ophthalmology, ocular inflammation and immunology, preventive medicine, addiction medicine, and endocrinology. So that's a lot of big words. Dr. Meehan attended Oklahoma University College of Medicine, where he served as class president and received the prestigious Presbyterian Harris Medical Student Research Scholarship. After completing an internship in internal medicine at Oklahoma University in Tulsa, Jim began his training at Washington University and Barnes Jewish Hospital in St. Louis, a top 10 ranked ophthalmology residency program. In addition to serving as chief resident of the John Cochran VA Medical Center, Dr. Meehan served 3 years serving as an associate editor for the Journal of Ocular Immunology and Inflammation. Once again, a lot of big words. While serving in this capacity, he learned to discern high-quality medical research from the low-quality, biased, and contrived pseudoscience used to promote pharmaceutical industry products. He participated in clinical research investigating the associations between military vaccinations, evidence of previous retinal vasculitis, and Gulf War syndrome. I'm actually proud of myself. Dr. Meehan is a 5th degree black belt in Taekwondo. NAGA World Jiu-Jitsu Champion, and 2013 Living Legend inductee to the Martial Arts Masters Hall of Fame. He has dedicated his career to exposing the greed, fraud, and pseudoscience responsible for the corruption of the American healthcare system and the intolerable harm, suffering, and death of America's children perpetrated by an out-of-control, unaccountable, and uncaring vaccine industry. With that, I introduce you to Jim Meehan.
A lot of big words. Obviously, Congressman Mullins hires the best.
Yes.
So my name is Jim Meehan. I'm a medical doctor, and I'm an ophthalmologist that's trained in ocular immunology and inflammation. That's my specialty. It's my area of focus. So I know a lot about the immune system, about infectious disease. And as a young member of the United States Army at the United States Military Academy, I took an oath to serve and protect the members of this country. Later in my life, I also took an oath to do no harm. So on many of the topics of which I speak, it's about seeing the harm and trying to protect the community. I see so much fraud and corruption and pseudoscience being perpetrated in our population, in our society, and the way medicine is handling things. We've seen it in the opioid epidemic. We're seeing it now about these mask mandates, the lockdowns, these experiments that are the first time we've ever, made these kind of recommendations to the population, and they're not working. If you have any question about where the science is on masks, and I'm going to talk to you a lot about the science, but one of the things I'd like to do, I'm looking for it here on my phone, is to remind us of what our public health authorities said early in the pandemic. On February 29th, you had the U.S. Surgeon General, the top doctor in the United States, say, people, don't be silly, stop wearing masks. They will not work to block the coronavirus. Does everybody remember that?
Yes.
Maybe you remember Dr. Anthony Fauci saying something very similar and publicly. The World Health Organization said the same thing and for many months. The CDC said the same thing for many months. And then they changed their narrative. But you know what didn't change? The science didn't change.
Yes.
The science that we have, the highest level of scientific evidence that is available to the population is called a meta-analysis of multiple randomized controlled trials. That science has been available for some period of time. It's based on the transmission of influenza, a virus that has many characteristics that are very similar to this SARS-CoV-2 coronavirus. Very similar, same size, has a lot of the same transmission characteristics, has an incubation period, a lot of the same characteristics. That randomized controlled trial, the meta-analysis of influenza transmission in healthcare workers in a sterile healthcare setting, clearly tells us that masks do not work to mitigate the transmission of influenza. That's a meta-analysis of many randomized controlled trials. There's a number of those. We've been studying that issue for about 30 or 40 years. So that's why we don't recommend masks during an influenza outbreak, right? It's why we don't wear masks during a measles outbreak, because it'd be like trying to stop a mosquito with a chain link fence. It doesn't work. And that's why our public health authorities were telling us not to wear a mask. But then they changed the narrative. I don't know why. It wasn't based on the science. No new science has come out. It's too early in this process to have engaged in randomized controlled trials. In fact, they're being told we shouldn't do randomized controlled trials because that would put people at risk. The people that aren't wearing the mask might be put at risk. I've heard that narrative many times, and yet that is the gold standard to which we should always go to prove a medical intervention. Because you know what? Medical interventions have risks. They have this medical intervention that your city council and your mayor are going to consider is a medical intervention. Number one, I don't think the lawmakers and our civil servants should be engaged in recommending or mandating a medical intervention. That should be left to the individual and their doctor in consultation. When we recommend something in medicine, we have a legal and an ethical obligation to talk to you about risks, benefits, and alternatives. That process is called informed consent. It's an ethical and legal obligation that we really instilled in medicine after the Nuremberg trials, because the Nazi doctors didn't obey those rules. So we have this informed consent process. Now, in informed consent, and I've done it over 20,000 times. By the way, I've also worn a mask for over 10,000 medical procedures in a surgical suite. We know from that process that you can only wear a medical mask. A study of surgeons showed that wearing a medical mask in long procedures decreases arterial oxygen levels, starts to induce some brain fog and tremors. I'm an ocular surgeon, so I did a lot of fine detail work under a microscope, and I would have to be careful about changing my mask. And I'm wearing a mask in an environment that has a very high level of air exchange. Temperature is low. The filtration system cleans out all the particles. There's a higher level of oxygen. And yet in those environments, that perfect environment to minimize the adverse effects of wearing a mask for more than 30 minutes, it still induces arterial blood gas changes that have a physiologic effect, an adverse effect on a human being. Imagine if that happens in a surgeon after 30 minutes in an operating room with these favorable conditions. What is it like when you're wearing your mask in your car in the middle of an Oklahoma summer and you're wearing it for long periods of time? Or the biggest problem that I have with this process is they're telling you to wear a mask, which may cost you $30 a month if you wear one once a day, but you're reusing a non-reusable, one-time use device. You're contaminating that mask. It becomes essentially a trap that catches not only what you're breathing out of your lungs, that blocks your arterial, your oxygen intake and causes you to rebreathe your own CO2, but it's also becoming contaminated over time. It's warm, moist, it will grow bacteria, fungi, and other pathogens, and that's why in a healthcare environment, we never reuse it. But how many people are reusing it? I saw some people walk in here today with a mask in a little bag as they were walking in. thinking that that's, at least they're trying to keep it sterile. The inside of that bag is contaminated if they're reusing that mask. Yes, do you have a question?
Actually, I was not reusing that mask. That was a sterile bag that I brought.
Oh, it's good. So that's the,
mask.
oh, good. That's the way you should do it. So,
Right.
so how much did you spend for your mask?
I did not. I'm a healthcare professional.
Oh, okay. So yeah. So healthcare professionals. Sorry, clearly I kind of irritated you a little bit.
We all have misinterpretations, and that's what I'm here to point out.
Yeah, and I'm here to point out that thank you for that. So what she's pointing out is when you're in a healthcare environment, we have lots of fresh masks. We always get a new one and we wear it fresh every time. So you're not reusing a mask. But what's happening in the public? I'll take questions at the end of it.
We do reuse masks.
What?
We do reuse masks.
Oh, really? In your hospital you do? That's a mistake.
Actually,
Yeah.
across
So
the United States we have throughout this pandemic. So yes, unfortunately, yes, that is the case.
right. So do you think that reusing a single-use mask is the right approach, or are we just doing that because we're running out of material?
Not the best approach, no.
Right. Yeah, that's the
Agreed.
point. So, and if that's happening in our hospitals, what's happening in the public?
Right.
Right? It's expensive to buy these masks. These things are not inexpensive. Right now, they're about 65 cents, best price on Amazon. To get these, it's higher in a lot of our local stores. So if you got a family of 5, you're talking about $180, $150 a month. And in an economy that has already lost 40+ million jobs, there are people struggling to make ends meet. And we've got an unfunded mandate. So to your city councilors, I would say, be careful about mandating something that will really cost your population. If they want to do it right, if they want to wear it in the best case scenario, you're going to have to wear it once, throw it away, short period of time. That means that you might be having to buy, 3 or 4 throughout the day, as many of our healthcare workers should be wearing them. And I'm distraught to hear that our healthcare workers are having to reuse a one-use disposable mask.
Yeah.
That might be a big part of the problem, why so many patients that go to the hospital are dying in the hospital. Because we have managed the medical side of things horrifically. All you have to do is see what is happening in New York City. 88% of people are died on ventilators. We need to understand what's being done wrong, because a lot of it's being done wrong. And we don't want to foist upon our population a mandate that would cost them a lot of money if they want to do it right, and if they do it wrong, it could cost them their lives.
Yep.
Okay? So the other aspect about this, we're asking the population to wear a mask, but we haven't educated them in how to wear a mask. Our healthcare workers are pretty well trained in how to wear a mask. If you do it wrong, you get hazed. your nurse instructors, my attending physicians, they would train us very well in sterile procedure, right? Mm-hmm. But what training have you gotten? I've seen the stuff online. It's wrong. Most of it is pretty horrific, and most people aren't paying any attention to it. So they wear their mask on their chin, they move it below their nose, they put it up on their head, they take it off, they throw it in the car seat or on the counter at home. They're contaminating everything that they're coming in contact with. Mm-hmm. They're doing it wrong because they haven't been told how to do it differently. I'll take questions at the end of the discussion, all right? So when you're not trained in how to do it properly, when you don't know that there are risks associating with doing it wrong, we're setting up our population to not only not mitigate the disease, but potentially to make the disease worse. Let me tell you another thing that really concerns me about the nature of this virus, or pretty much any respiratory virus. When we get infected with SARS-CoV-2, influenza, or any respiratory virus, our lungs, it's replicating in our lung cells, or lung pneumocytes. Mm-hmm. That virus will replicate in the cell until it bursts free from the cell. And then it will be released into the airways and we will breathe it out. Mm-hmm. Typically, those respiratory droplets will fall within 6 feet. Most of them will fall within 3 feet. That's why social distancing is important. Mm-hmm. But when you put a mask on your mouth, you're now catching that, what would otherwise be exhaled and falling within 6 feet of you, you're catching it in the mask itself. Now you're rebreathing those viral particles. It's like getting mouth to mouth from a COVID-19 patient. It's a bad prescription for worsening of the disease. Now, we know that masks also inhibit air inflow and they can lower arterial oxygen. The nature of the SARS-CoV-2 virus is it has what's novel about it that's different from SARS-CoV-1, one of the things is it's got a specific genetic domain called a furin cleavage site. That furin cleavage site makes the virus worse at lower arterial oxygen levels. So now this virus is transmitting through the population at a fast rate. It's just the nature of this virus. That cat's out of the bag. Now we're talking about putting masks on a lot of people that might have a mild or asymptomatic case. So the worst thing that you can do is put a mask on somebody that has a mild or asymptomatic case. They will rebreathe those viral particles, they will lower their arterial oxygen, and they will increase their viral load and the infectivity of that virus to enter cells and cause damage, to induce this cytokine storm that can essentially melt the lungs. So it's the worst prescription that you can possibly do is to put a mask on someone that is carrying this virus. Now we were told that we should wear the mask because there's this asymptomatic carrier concern. Now, careful contact tracing studies conducted throughout the world, multiple sites. Dr. Maria Korkov of the World Health Organization, who follows these studies in this area in particular, has told us that asymptomatic transmission is very rare. Study, for example, in one careful contact tracing of a patient with COVID-19, they followed 455 contacts, and one person out of that 455 that were exposed to the original individual developed a mild case of COVID-19. So that's a very rare transmission. Asymptomatic transmission is, we still don't know everything about it, but we have a pretty good idea that asymptomatic transmission is extremely rare. We're also following children in other in schools like Germany that are now their kids are back in school, and transmission in that population is extremely low, almost non-existent, so very, very low. So we've got all these, we've been told a lot. The story that really perplexes and frustrates me is you've been told this is just one side of the story. Masks are all benefit, nobody's talking about the risk. And I'm here to talk to you about the risk, and there are many. It will block your oxygen, it can force rebreathing, and I've done those studies. People can say that, you know, it doesn't cause hypercapnia is the term, the medical term that describes CO2 retention in the body to levels that cause symptoms. Now, I've done studies we have a CO2 monitor, and we bought a new one recently so that we could measure this, because there are some standards. The Occupational Safety and Health Administration has very clear standards about employees that are forced to wear masks. They have to be tested. They have to see a medical doctor, be screened. I'm going to talk about that here in just a second. But the toxicity level of CO2 in the environment, as measured by OSHA, is 1,000 parts per million for carbon dioxide. When you put a CO2 monitor behind a mask in 35 seconds, tested in my office with a brand new calibrated machine, it goes off the meter's ability to measure 9,999 parts per million, so 10 times the OSHA levels in 35 to 37 seconds. And that experiment has been replicated all over the country. And so if we're going to city councilors, if you're going to mandate masks, understand that you need to provide some policies. You need to, there's a large percentage of your population that may have contraindications to wearing a mask. Not everyone is young and healthy and has a strong respiratory system. They could have pulmonary fibrosis, silicosis, COPD. There's a long list. OSHA requires employers that mandate or require masks for the worker to do their job, to have that individual see a medical doctor, to be screened. This is the OSHA section 1910.134 for respirator medical evaluation questionnaire. It's, it's 17 pages. And it's a lot of questions about your health history. If you have a cardiac history and you're lowering your arterial oxygen and depriving your heart muscle of that important oxygen, you could be precipitating more damage to the cardiac muscle. There's so many issues that have to be screened. So when you do what Tulsa did and they passed a mask mandate, I've had two individuals come to me, managers of restaurant chains, saying, my wait staff is complaining. They're getting headaches. They're getting lightheaded. I have to sit down. They're taking days off. They work on the patio. Their mask is contaminated, and they're just having problems. It's one of the employers that we did the testing behind. They're suing the Tulsa Health Department, saying you're violating. You put this mandate on us. We're responsible. We got to mask our employees, but now I got to send if I want to comply with OSHA regulations, I got to send them to a doctor. I got to do all of this stuff. The public may not be required to do that, but they should before they put a mask on. How many people are walking around with a respiratory problem that they don't know about, that when they put a mask on, they could be dropping their arterial level significantly? These are the concerns that have to be considered. There's consequences to politicians mandating medical procedures. If we're going to follow some policy, then we either better develop the policy or we should adhere to the OSHA regulations. And those regulations, they got a lot of cost, expense, and labor required to be able to be in compliance with those standards. Did I miss any big topics? This is my lovely wife, Kathy Meehan. She's a science savage as well, and beautiful, and 30 years we've been married, and mother of 5 and 3 grandkids. Yeah.
I'd probably talk about what are alternatives, because I think one of the big concerns is that everybody has fear, and the people who are pro-mask, they have a fear that they're going to catch COVID or they're going to spread it or whatever, and then the people who don't want to wear a mask, they have this fear that it's going to impact their health and lose freedoms. I mean, everybody's got that too. So both sides have this fear.
Yeah.
And I think when we look at that, we have a couple of things. How do we calm the fear? What are some of the good things about or the over-exaggerated numbers? Maybe touch on that and then touch on alternatives.
Right. Yeah. So let's acknowledge the fear. Right. There is a lot of fear in our population right now. Fear fear of this virus, and it's kind of really putting us in a dark place. And I think Hosea Scripture says the people are destroyed for a lack of knowledge, and I think bringing you some knowledge is a big part of countering the fear. God did not create us with a spirit of fear and timidity, but of power, love, and a sound mind. Let's use our sound minds to combat this issue. Let's learn what recognize each other's fear. The other thing I hate seeing in the population is this divisiveness. If you're all for masks and you bought into that section of science that you believe supports your wearing of a mask, and you think that other people probably didn't read it, I can tell you I read it all, both sides. Clear to me that the science is being misused to mandate masks. The science is being misused. There is no meta-analysis and randomized controlled trials that say you should be wearing a mask. They don't exist. That we're using a lot of lower-level evidence, observational, retrospective studies. So, but it's creating this divisiveness. People are looking at each other strange. I went to the grocery store the other day. Kathy was with me, and it's like people are moving away from each other. They're looking at each other with fear, and it's, man, if you don't recognize that as a manifestation of the spiritual warfare that's going on here, that in and of itself, that fear is destroying, it's lowering your immune system, that we're creating this division in the population that you can't miss that. And you can't miss the health consequences of that. When you do this kind of stuff in your population, and it's so much of it is based, in my opinion, on pseudoscience and misinformation, that it is going to create fear, and there might be, the enemy works through fear, right? It's one of his most powerful tools. So let's recognize that a lot of people are fearful, but you have more control over this than you realize. Number one, we have shown now, Dr. David Brownstein published a study, peer-reviewed study of 107 patients that he treated with vitamin D, vitamin A, vitamin C, and iodine. I would probably add to that some zinc levels and some other things, but there are low-cost therapeutics in the nutritional supplement area that have shown to be very beneficial. We should stimulate our immune system. We'll never be able to mask and isolate and quarantine against every virus that is out there. At some point, we should recognize that we probably know the tip of the iceberg and all the viruses and pathogens that are in our environment. And so our best defense is the one God created. It's our immune system, and we should strengthen it. Eat right, get some sunlight, get some fresh air, smile at other people, have good thoughts, congregate and fellowship in your church or whatever your means is. But isolating and terror and fear in our homes is going to destroy far more than anything else. So there are therapeutics. Now, I could go forever on the pharmaceutical fraud, corruption, and pseudoscience that's been perpetrated against some of these low-cost therapeutics like hydroxychloroquine, azithromycin, zinc, budesonide, a $237 course of treatment, budesonide, or low-cost anti-inflammatories and steroids like dexamethasone. We have now countermeasures and therapeutics that can put out that fire of the cytokine storm that we didn't have early in the pandemic. But you're not hearing enough about those. You're hearing about a $3,200 course of therapy with remdesivir that has about a 20% adverse event rate in the clinical trials, by the way. So, and there was a number of studies that came out that said that hydroxychloroquine was damaging, that was adverse for your health. And then we found out that large study published in Lancet was absolutely fraudulent science fiction. That the publishers of that, the experimenters in that study fabricated the data. It didn't happen. They could never produce the information, but that lie was halfway around the world before the truth got out of the gate, before it was ultimately peer-reviewed and absolutely destroyed by the scientists that reviewed that science. And then Lancet had, with egg on their face, had to remove that study. Before that, there was a VA study that was absolutely fraudulent as well. Three of the participants that authored that study were Gilead Sciences, the maker of remdesivir. They had received funds from Gilead to do other research on other areas. So there's, as a former medical editor, this is what I did. I looked for bias and fraud and poor methodologies in the scientific literature. I know the difference between, a randomized controlled trial and a retrospective observational or a case control study. The people that believe that you should mandate masks and wear masks all the time, everywhere, are relying on lower level evidence of science. And there's a lot of it, because it's easy to do and you can make it say whatever you want. Literally, you can make an observational retrospective study say whatever you want. I see it all the time. And there's a bunch of it. So they put a big old stack of non-peer-reviewed, preprint articles that are case reports or retrospective analysis, and they say, see, this is the science. And I say, yeah, but you don't understand that the evidence there is so underpowered. It's so much less than a meta-analysis and a systemic analysis of multiple studies. And those studies, my science says, mask mandates and wearing masks is not the solution. Washing your hands, social distancing, quarantining when you're sick. When you're sick, stay home. Don't put on a mask and go walking around. Just simply stay home. Quarantining works, but quarantining the entire population, including healthy people, that's the first time this experiment has ever been done in the world, and it's failed. Quarantining, lockdowns, what we did to this country was a mistake. It's anti-science, it's fraudulent, it's corrupt, and it failed. Prima facie evidence that it doesn't work. And every country that did it did very poorly. You know, we talk about masks. I can tell you, 40% of my colleagues in Italy were not only wearing a mask, they were wearing N95 masks. They were wearing face shields. They were wearing essentially hazmat equipment over their entire body, and 40% of them still got the virus. Because it just, those interventions aren't stopping it when you're exposed to it in those kind of environments. Our healthcare workers, God bless them, and thank you for the work that you do. You're putting yourself in harm's way, and we acknowledge that courage and that bravery in doing what you're doing. But just because we got to do that in the hospitals, and I'm so sorry that your hospital is not giving you a large supply of PPE, because you should demand it.
It's not that they don't have it, it's not that they don't want to give it to us.
Well, if you go on the coronavirus website by the state of Oklahoma, they say they have 2.2 million PPE pieces of equipment, so I don't know.
Then tell them to give it to us.
Well, tell your CEO to go get it.
We do, and they do. They're working diligently.
Right. Well, it doesn't matter, you're still doing it wrong. Right? Your CEO's doing it wrong. Go get it, buy it someplace else, but you know, that doesn't make, you know, the problem is not yours.
It doesn't make it okay, but they are just as diligently as I am trying. They are as well. We have poor leadership at the top. That's not.
No, you have poor leadership at your hospital, bottom line. So, because if I was the CEO of your hospital, I'd go get it.
It starts at the top. It starts at the top.
Well, the top says you got 2.2 million pieces of PPE. So, yeah, I mean, I think at some point we all have to take responsibility for, you know, and so it's the prerogative of your employer to go get the PPE. So, because we don't have the same problem in various hospitals in Tulsa, Oklahoma.
Okay.
Okay.
CEO, is that coming from, please?
What's that?
CEO, are you referring to? You said hospitals in Tulsa, which CEO?
Yes, St. John's Hospital.
Okay, that CEO would go on record saying he's not having done.
You can ask him if he would like to go on record.
Okay.
Yeah,
Okay,
yeah.
great.
We can do this all night, by the way.
I know.
Any other questions? Let's open it up for questions. And see, this is the frustration here. Do you feel the tension?
Yes.
Yeah. You feel the tension. So she's frustrated, and I acknowledge your frustration, and she really wants to pour it out. Right? I'm not the enemy here. I'm just bringing another side of the. So don't treat me like I'm an enemy, and you won't get it back from me. But you're probably doing this. Maybe it's because you're wearing the mask and it's blocking your oxygen and you're retaining your CO2 and you're just getting angry.
No, I do have a question though. What study are you referring to that shows the decreased CO2 and decreased oxygen levels with masking?
Yeah, it's called, well, I call it the surgeon study. I can send it to you. It's a study, I think it was 135. So yeah, send me your email, and listen, I don't say anything that I can't back up, and it's, and there's a lot of studies that are available on this, and it's interesting that you haven't looked. Are you a nurse?
I'm a nurse practitioner.
Okay, and so you have you looked at the science?
Yes, I have. I'm
Okay.
actually, yes.
And so you think
I
masks?
have a master's of science, yes I do.
What's that?
I have a master's of science, yes I do.
Okay.
Understand how to.
Right, so a master's of science doesn't mean you read the science, it means you know how to read the science.
Neither does an MD.
Right, but being a medical editor and having, I've told since the beginning of the pandemic, when we're getting mixed messages from our public health authorities, I was like, what's going on here? Why are, we got for a while it was the WHO versus the CDC, they had different messages. You got Fauci saying one thing in February and March, and then saying something completely different. So, who do you believe? And what time do you believe your public health authorities? They're sending mixed messages, and they're not supporting it by science. If you go to the CDC website today, and you look at their scientific references for wearing a mask, and by the way, they recommend wearing a cloth mask, which has been shown in multiple studies to be useless. And in fact, you're more likely to, yes.
Oh no, that obviously I'm frustrating you. Go ahead.
Yeah. Well, just ask your question. I apologize. I'm not frustrated, but I am frustrated. I'm not even wearing a mask, so I can't imagine what you're feeling.
And you're not even wearing a mask. Is that your oxygen levels?
I'm not sure.
Okay, I'll defer.
That's right.
There's other
Good.
questions.
Yeah. Somebody else have a question? Yes.
I'll throw a different angle at this. I'm buying what you're selling. What city council member is going to be held accountable when a kid like that passes out of school?
Right.
Is there a doctor that's going to
Yes.
say, I take accountability for every one of these kids? I got to send my kid to school and make them wear a mask 10 hours a day.
Right.
So who is going to put their license and their insurance on the line for that?
Well, I think
City council members can sign it.
that's a key question. You know,
It's what they do.
when this percentage of your population that has respiratory pathology, you know, decompensates while wearing a mask, who's responsible? The city council probably won't be. And you know, when employers are forced their employees to wear a mask and they have to adhere to OSHA regulations, you know, who's funding that unfunded mandate? You know, you're putting a lot of burden on. I would also say, you know, what's happening in Tulsa right now is it's another mini shutdown of the economy. People are leaving. You know, they didn't pass masks and Jinx, mandates and Jinx and Sepulpa and Broken Arrow. So when we got to go get our hair cut or go to the restaurant, we go to Jinx, Sepulpa, or Broken Arrow, where we don't have to do the ridiculous contamination dance of wearing my mask until I sit down, then I take it off. Where do you put it? I guess you put it on the table. Or hopefully you do the right thing, which is you pull out a fresh one from your supply of 50, you know, masks that cost you
Doesn't work
$30.
anyways. Miami, Florida is a prime example. They've mandated masks since March.
Right.
And they're still the highest place in the country.
Right. Same thing in
So
California.
It doesn't work.
Right.
So.
Yeah, no, I predict, and we will eventually have the science, we're seeing it play out in California as well. They're a month into their mask mandate policy, and their rates are going up. Could it be because, you know, it's passing around the population, but we're masking them, and they're rebreathing their viral particles, increasing their viral load? Are we going to increase case fatalities through that process? You know what? We don't know. But there's some evidence that might be one of the risks, and nobody's considering it. Nobody's talking about it. It's all benefit, and nobody's talking about the risk, and there are many. Yes.
Yes, sir. I've been stuck, and I'm glad you brought up OSHA. Real glad you brought up OSHA. I used to be a professional painter. Okay, I handled fumes of all kinds of products.
Right.
I had to have a special mask to block these fumes out. Okay, if I wore a mask that doctors or healthcare workers use, they would be bringing me into the emergency room, and I could be going into cardiac arrest.
Right.
Okay, so OSHA has specifically stated that none of these masks work. The N95, for instance, with the respirator in the front,
Right.
it helps on the inhale,
Inhale, yeah.
but on the exhale,
You're just blowing out.
you're just blowing it out.
Yeah, so that won't protect against
Exactly.
Yeah, asymptomatic.
And the masks that the healthcare providers wear, it entraps everything. Okay, so that mask, OSHA says it does not work.
Right.
Okay, and these cloth masks, bandanas, everything else, you're exhaling and you're inhaling the same air. That it doesn't matter if you're 6 feet away, 5
Right.
feet away, whatever. You're still going to inhale it.
Right.
So my question is there a mask of any kind that could help more than any other mask that even
Yeah.
OSHA has?
Yeah, they're called assisted respiratory devices, or PAPRs. They're what you see in the movies. They basically look like a spacesuit, so that the air supply is internally supplied and highly filtered. They're a sealed environment. You know, there's no air coming in through the sides or through. So but unfortunately, you're talking about several $1,000s.
Exactly.
You know, so that's the only device that I would wear to protect myself from a highly contagious kind of virus.
And that's what I was getting at, because the mask that you are telling us about right there, it is completely. You would have to wear it, And they still have filters on them masks.
Right.
That you're talking about. They have a filter and then they have an inner filter, which takes care of just about everything. When I was in the Army, we went through what they call the gas chamber.
Right. Remember it well.
Exactly. Now, even
But you have to take off your mask.
you have to take off your mask.
And do push-ups.
Right. And what it did to you, what wasn't good. But I'm telling you, I'm just saying, these masks, according to OSHA, does not work.
That's right.
So why make this really work?
Yeah. Well, again, the science says that they don't work.
Right.
Our health authorities said they don't work,
Right.
and they changed their story. Let me ask you this: Are some of the hospital workers wearing cloth masks in the hospital?
No, the employees are wearing hospital grade masks.
Good.
And some N95. But another question I have is about the masking and the fact that we as healthcare professionals for the past 5 months at least have been wearing masks and reusing them. I have not seen any evidence that shows that there has been any deleterious effects as far as increasing our own risk of infection or cell contamination or over the long period of time of any study showing that wearing a mask 8, 10, 12 hours a day causes any deleterious harmful effects that have been borne out in research. Yes, there might be. I haven't seen the evidence that you're talking about that shows decreased oxygen levels. I can say from my own experience, I've gotten on a treadmill with an N95 for a good 30, 45 minutes. My oxygen level didn't go anywhere and I was running and
Right.
my heart rate
I mean,
up.
you look like you're young and fit.
I hope- and I agree.
Not everybody responds the same way.
Right,
And
right.
that's what we have to recognize, is that there's a percentage of the population that aren't in the upper echelons of health and fitness and respiratory
So
condition.
where is the research or is there any research that shows that those of us who have been reusing masks, people in the community, now we have hundreds of thousands of people who are wearing cloth masks, are wearing hospital masks and reusing them. Where is the evidence to support that we are reinfecting ourselves or making ourselves sick?
Well, most of the studies that were done, there are studies that compare N95s to surgical masks to cloth masks. And those studies, to answer your question directly, there's not a lot of science, and specifically to
Is there any-
SARS-CoV-2, there's not a lot of science that has looked, we haven't had time to look at those issues, or at least it's not being reported at this point.
Right, is there any science to suggest that cloth masks, surgical masks, N95s or otherwise being reused and reworn as we have been and as other countries have been doing for much longer than us that show that we are increasing rates of infections of other types or of worsening SARS-CoV?
Well, I think yes, yeah.
Where's the evidence?
You should look for it. There's a lot of it. In fact, that's why OSHA's regulations were created. That's why we don't recommend reuse in that. You asked a question, and I'm going to answer it. So that's why we don't recommend reusing single-use masks in the hospital. You acknowledged that at the beginning of one of your first questions, right? So is there any evidence that reusing masks is safe? That's the corollary of your question. I think common sense, and anybody that's been trained in the medical profession should recognize the potential for contamination of their mask. That is why we are highly trained we wear a mask into a patient who has TB's room. We take it off and throw it away when we come out.
Right, but that doesn't mean that we are necessarily doing ourselves harm. And what we're seeing, what I understand is what we are seeing is we have not seen any evidence to show that reusing a mask is causing anyone any harm.
Well, I would imagine that if you finding enough healthcare workers that would be willing to subject themselves to that experiment is going to be very hard to find. I would personally not, but maybe you would want to sign up for that kind of a study where we're going to have a control group that uses a mask once and throws it away. They use it like we're trained to do, and then there's a group that just wears their mask continuously. They wear it to you know, in the hospital, to dinner, and every place else, or just in the hospital. But that's not a study that anybody's going to want to sign up for, because the principles of infectious disease say that we should not do it.
Right.
Infectious disease experts are saying, don't do it that way.
But we
Here's
should
the way
also-
we're supposed to be wearing our masks.
We should also see the evidence before us, as you have said before as well. And with SARS-CoV-2 and with what we're doing now, there is no randomized controlled trial because we've never been in this situation before.
Exactly. Yeah,
And
so that's
SARS-CoV-2
why we have to rely upon the science that has been done with influenza. That science is really clear.
Right, but influenza is not COVID-2.
That's right, but it's the same viral size, right? It has is it the same viral size? Let me ask.
It's the same viral sign.
Okay.
That's the
Does it have
only-
similar transmission characteristics?
That's like saying you and I are both humans.
Well, until we have randomized controlled trials, I think we are. So we are, right? The point is that you have to use the science that we have, the best evidence that we have. So the best evidence that we have says that wearing masks in the community is not going to help mitigate the virus, because people aren't going to know how to use it. They're going to contaminate themselves. It's going to spread disease. I don't think we should be in disagreement in that. But
Studies are showing that masks are working, that masks do work. So,
what study?
I can send it to you.
Okay, please do. Yeah, because this is what I do all the time. I ask people.
I do too.
I ask people to send me the studies that justify their position, and then we look at those studies and compare. You know, because what I often get is I get a retrospective cohort analysis. I get case controls. We recognize that there's a hierarchy of medical evidence, and so we're going to finish there, and we're going to let some other people ask some questions, because this is not a filibuster.
Yes.
I'm not a scientist, but I am 71 years old and I've been breathing for all those years. And I can tell you that after putting that thing on in 15 minutes, I feel lightheaded. I have to take it off.
Right.
And it has been affecting where I go and what I do.
Right.
Also, I have a granddaughter that's a manager at McDonald's, and in one shift, they had 2 of the kids that were working there faint dead away.
Right.
And had to take the mask off and send them home. I know that it's causing this.
Yeah.
I mean, I don't need a scientific study to
Right.
know that when I put that on my face, I can't breathe.
Right.
And so I am not willing to do that. And I don't think we should be willing to force other people to do it.
Right.
And you know, this is the United States of America.
That's right. Yeah. No, I do, and that's what I'm hearing in our community too. I was surprised, you know, when I, posted some information like this. I had a lot of people contact me and tell me the exact same story. But the problem is they don't want to speak out, because you get kind of this, back and forth. You get this aggressive shaming of people that have a contrary view. You know, it's one thing to be wearing a mask, for prolonged periods in a hospital where the air characteristics are very different. You would recognize that the characteristics of the air quality and air exchange in a hospital is extremely different than what they're experiencing in a McDonald's, right? And you're in a pretty sterile environment. The other thing about these masks is the more polluted your environment, the more that the pores are going to be blocked up. The more they're going to start creating, the more moist they get, continuous wear or growth of whatever might be growing on that petri dish that's strapped on your mouth, the more of a problem that it's going to cause for your respiratory system.
Oh, go ahead.
Can you talk about masks for children and schools requiring masks?
Yeah, I really think that we're going in the wrong direction if we start masking children. The evidence is that, the blessing, if there is one, the glasses always half full, right? The blessing is that this virus is very low virulence. It's not as pathogenic in young people for a variety of reasons that we don't fully understand, but the disease process in children, I think we've had 1 death in Oklahoma. I may be wrong about that. 1 death in Oklahoma, and a child had multiple comorbid conditions. I think we've had 24 in the United States, certainly less than 30, but it's a very low disease. That same story is playing out in Sweden and Germany. Saxony, Germany published a study recently of school-aged children and the lack of transmission, very low rate of transmission in that school population. So they aren't masking their children. all of these issues of blocking air inflow, kind of, when you wear a mask, you get tense. A lot of people do. It's a common kind of complaint is I feel tense, anxious, lightheaded, brain fog. That's why people are always pulling it down so they can breathe, again, contaminating it. So I really hope that we don't go the direction of mandating masks for our children. In terms of this informed consent and risk, benefits, and alternatives, if you have no other choice, I would recommend a face shield over a mask. I think that, think about the portals of entry for a virus. A mask just blocks your mouth and nose, but your eyes, the mucosa of the eyes are also a portal of entry.
Yeah, that's right.
So, wearing a mask is 2/3 of the equation if you believe in blocking, that's going to prevent infection. So I also think that the airflow and the clearance, and more importantly, at least with a plastic face shield, you can clean it. You can better sterilize. It's very difficult to sterilize a woven polymer and a cloth mask. Very hard to sterilize, and and you need to clean it frequently, or you're simply creating all these problems of contamination. So I think that would be an alternative that we should explore, rather than just a mask that blocks 2/3 of the portals of entry. Yes, sir.
Yeah, one thing that's really confusing me, and I know that there's so many passionate people that really care about humanity on both sides.
Right.
And I think that the divisiveness that we even sometimes feel in this room, is just sad, because I believe in humanity, and I believe we care about each other. And I believe that both sides care, and both sides are listening to science. And it's a lot of people that have different opinions that think that, you don't care about humanity unless you are listening to my doctor.
Right.
My doctor knows better than your doctor.
Right.
And the thing that really confuses me, because I'm trying really hard to hear both sides, because I think that the other side of both arguments, I think they have great points to make.
Sure.
And a lot of what you've said about masks, I've heard from the other side, saying, yeah, they're not great, and we're wearing them incorrectly. And I even heard the doctor here in this town that's been advising our city councilor make a point why children under the age of a certain age shouldn't have masks, because they're ineffective, because the kids are going to touch their faces constantly.
Right.
And they said, one kid touching their face one time is just, that mask is, the whole day is gone.
Yeah.
Because they have touched everything in the room, and then they're putting it right where they shouldn't be touching it. Right. And so my question is this. Early on, I heard our own government make the case multiple times on why we should not buy a mask. They went out, they had press conferences, they gave science.
Right.
The science that you're giving on why they're not effective and why you shouldn't be doing that, and I bought it. And now we have a completely different narrative. And my question that I keep asking is, did physics and science change?
No.
Because the argument they were making months ago it had to do with the size of the particles and the way that they were coming in and out of the masks. And now I'm hearing they're saying that all of that has changed. And has the COVID virus gotten much larger now? It's hard for me as a person that can think to look at all that information and go, what is going on? What is happening, and why are we here right now? And I want to believe both sides, but it's hard for me. My head is spinning. I haven't talked to anyone on either side whose head is just not spinning daily. The CDC changes their mind. The WHO changes their mind. Our own government changes their mind. And I don't understand it, and everybody is just trying to find their way in the dark, is what I feel like.
Yeah.
And I don't feel like that's a good decision. I feel like we're trying to cut vegetables with a sharp knife in the dark.
Yeah.
And everyone that I'm hearing is just kind of fumbling around. And my question, I know I've said a lot, but has the science changed from the first time that our government told us not to wear masks to today?
Well, yes and no. We know a lot more about the virus than we did then. But in February when we didn't know much and they were telling us, don't wear a mask. I mean, here's the tweet. Seriously, this is the U.S. Surgeon General, 2/29/2020 at 6:08 a.m. He got up early. He's tweeting. Seriously, stop buying masks. They are not effective in preventing general public from catching coronavirus. I mean, what about that is ambiguous? Yeah, somebody want to explain? How about I give this gentleman an opportunity?
I want to take my mask off so y'all can hear me.
Yes. I breathe.
Okay, the science hasn't changed. I have a feeling the CDC, number one, is acting on incomplete information because of the Chinese Communist Party, okay? The World Health Organization, we know, is beholden to the WHO as well. I think the CDC said what it did to preserve stocks of masks when this first started because there was a big crunch on PPE. Now that we have adequate stocks of PPE, there are more and more studies that show the effectiveness. This has been made into a political hot potato. The studies show that masks help stop the prevention. They don't stop it completely, but it helps. If you want the economy to recover and we don't want to starve in the dark in a Mad Max environment, we need to stop this and we need to slow it down. And the mask will help. It's not going to fix it all, but the mask will help. That's good science.
It's the best science.
Are you John Meehan with Catalyst MD?
Jim Meehan, Catalyst.
Okay.
Mm-hmm.
So, do you have meta-analysis that support the supplements on your website, like Dopa Boost?
Yeah, actually, they're not of that in particular ingredient, that formulation, but they're precursors to things like, to dopamine. So, yeah, there's a ton of studies on things like vitamin D, vitamin C. Absolutely, right?
Vitamin D, getting some sunlight. But my point is, you kind of got a dog in this fight too with the supplements.
We tell
Yeah.
people they have a choice.
Yeah.
Wait,
So
no,
here's the thing. It's a great argument. Go ahead.
I want to say something. I want to just let you know that this man volunteers his time to do everything that he does in all the fights that he fights. And, we contemplated that about supplements. And so, you know what? We tell people here's the list of supplements we recommend. You are welcome to go shop anywhere that you want to buy them. Okay?
And if you read those studies, if you read anything that I've posted, there's always scientific references to the evidence that supports that recommendation for a nutritional supplement.
We had a lot of physicians that really have a lot to say about this. People that are board certified in infectious disease and
Right.
board certified in epidemiology even wanted to come here, but they didn't think that the science would kind of really have much sway on that. But anyway,
Right.
I
Yeah.
appreciate you make some good points, I think. But
Yeah, well, I want to counter one of the claims that you made. You said there's a lot of good science that supports wearing masks. I've looked at it. There's not a lot of good science. I think what you've looked at is, in medicine, there are hierarchies of evidence. There are at the bottom of the pyramid are anecdotes. And just above that are things like cohort analysis, case controls, retrospective observational studies. As you go up the pyramid, near the top is randomized controlled trials, where we're looking at control. It's the kind of experiment that you were taught to formulate in school, right? And then above that are the meta-analysis and systemic analysis, where they're collating all of the available high-level science and doing an analysis of that. So those studies, there are not a lot of them. There's none for SARS-CoV-2. We will eventually have those. Maybe we might have a few, just because this is it probably won't last forever. It's not going to be like the flu. But we have a good body of high-quality randomized controlled trials, meta-analysis and systemic analysis that have exclusively concluded one thing, is that masks are not effective in mitigation. That's why we don't recommend them for influenza in the general public. So if you want to claim that there's a lot of good science That's the point I made earlier. A lot of people say there's a lot of good science because you read about it on Facebook, you read the titles, you read the abstract, you didn't look at the methodology. If you think you have, we can schedule a time where we debate. You bring all your people, I'll bring mine, and we'll have a debate about the quality of the science. Because it really, it's about the quality of the science.
Absolutely. Yeah.
I'd just like to make a comment. He said something about Mad Max dying in the dark. Reality is, this county has 50,000 people in it. We have right now 2 people in the hospital. We've had almost nobody has died.
Yeah.
But this, like, that extreme analogy is brought up about how we're all gonna die in the dark.
My point was, that look what the.
I'll call on you in a minute. You had your, how about this lady over here?
Okay, my question is, if we're wearing those masks now and destroying our own immune systems with it, when the influenza comes in November or when it, it comes every year,
Right.
and when it does, everybody's gonna get it because their immune system will be low because they've been breathing in all of those.
Right.
So then
Well,
they say this is the same.
Yeah, we don't know. I mean, again, this is an experiment that has really never been done before. So we don't know what the unintended consequences of this intervention will mean to the health of our population. That could be right. We could be suppressing our immune system through the changing of the arterial gases in our, the gases in our bloodstream. We could be limiting our microbiome, which is a part of the things that help stimulate and improve our health in general, keep our immune system. There's so many things that we just simply don't know, and so I hope that we will be able to apply high-level science that's not biased, that isn't just trying to prove a point, it isn't just cherry-picking the science to try to justify their position. That's what we see so much in science. I mean, believe me, I don't have a dog in this fight. I'm not here to sell supplements. I make some recommendations on a lot of my articles because I know the science. We know that in New York City, 98% of the people that passed away of COVID-19, for whom we have data on, their vitamin D levels were well below 20, most were below 12. That's a characteristic that we have seen in people that die of influenza throughout the history of measuring those kind of things. There are factors in our health that we're just not considering because they're just not sexy. They're not a $3,100. Talk about financial conflicts of interest and financial bias. We've got a pharmaceutical industry that drives most of our medicine and our education in medicine, and they've got one purpose in mind. It's to bring money to the organization, and we're not always using the best science. And we want to trust doctors with everything that they say and think that they reviewed the science very well. Well, then explain the opioid epidemic to me. Because it's not just about people using illicit drugs on the street. About 75 to 80% of all drug overdoses started with a prescription from a physician. That's a fact.
He's got one back
Oh,
there.
yeah.
Oh.
Yes, sir.
Thanks.
And the unions.
I am not a medical guy. I'm just a local business owner. Okay? And good for you for doing supplements. I don't care about any of that. That makes no difference. I mean, whatsoever. I have a daughter that had to come home from studying overseas for a graduate program 2 months early because of this pandemic. She didn't get a great opportunity to go study archaeology. And she's having to finish here. I have another daughter that's getting ready to start back school. She's in the marching band. She's expected, I guess, by our school board to wear a mask out there on that blazing hot football field and twirl her flag day after day. And as a parent, I'm really frustrated. I don't care about the science between the two of them because I'm not medical. I don't understand it. You guys have that argument outside. What I really want is this is turned political in the United States, and I think worldwide. And I think I speak for a lot of people around America whenever I say, quit giving us the mumbo jumbo and tell us the freaking truth.
Yeah, I totally agree. Yeah.
So I've got one question. Oh, I'm sorry.
I promise.
Go ahead. Yeah.
Right.
I also am starting a job pretty soon working with pre-K students. And I think that's a lot of what Ginger was talking about too, and this gentleman is the pre-K students are not required to wear masks, but the teachers are. And so what does that mean for contamination or cross-contaminant transmission? And they're coming from their homes to, I mean, why is it okay for the 4 and 5 girls and not every, why does it, why can't we, why?
Yeah, well, I mean, it's a tough question. Yeah, so far the science says that the incidence of disease in that age population is so low as that, that would be one of the reasons. It's also much more difficult to get, a younger person to wear a mask. It's just that it's a complicated issue. They're unlikely to be able to wear it appropriately. They're going to be touching it more, contaminating themselves, whatever it might be. Whatever you're accumulating on the outside of the mask, they're going to touch and contaminate. So.
Well, I also came from the medical field,
Yeah.
Healthcare, and wearing scrubs. You wouldn't wear the same scrubs every day. Why would you want to wear the same mask?
Right.
So another question would be, if it's okay with my immune system and I'm okay with having no mask on, why can't I be around the children who are not going to be wearing masks either? You know what I mean?
Right.
It's so ridiculous.
Yeah. Well, there's been a lot of studies on, you would say, we wouldn't do something like there have been a lot of studies on doctors' ties and doctors' white lab coats, and because they don't really, launder them as much as you would think that they would, and they've grown out some very pathogenic bacteria. Because how often, it's just, you'd be surprised at what we do in medicine that just makes no sense whatsoever, and yet we're not thinking it through entirely.
I've seen healthcare workers not follow policy.
Yeah, absolutely. Sometimes they can't, We're learning tonight that sometimes they can't. Yes.
So, I 100% believe that, the healthcare professionals in the back of the room are doing everything that they know how to save lives.
Right.
And I believe that they're following the science that they have to the best of their ability. So my question is, from your side, how do we combat COVID-19 if we're not going to wear masks? What is your formula for taking care of this virus?
Well,
in your best opinion.
Yeah. If it was that easy, we probably would have figured it out by now. I do think that the sooner that we can detect the presence of the virus in our bodies and quarantine the sick, we also have to protect the susceptible members of our population, because that population has not changed. The population that is most susceptible to COVID-19, dying from COVID-19 in particular, is the same population that is most susceptible to every other respiratory virus, including influenza. That population in Oklahoma, I think the average age is 78.4 years. They have multiple comorbid conditions, and those, if you have an immune suppressive disease, you need to be the one that is protecting yourself. You need to, stay away from other people. You need to socially distance. You need to wash your hands frequently. You need to, you need to be the one that's cautious, but we don't all need to be wearing masks. We have plenty of people that are on chemotherapy, for cancer, right? And they might be in a neighborhood, and their immune system is horrifically suppressed. But we don't force everyone in their neighborhood or in their community or their city to wear a mask, right? And that's the new thing that we're trying right now. It doesn't make sense. It's not supported by the science, the high-level science, maybe some low-level science, but it's not supported by the high-level science. I'm going to come back to you. Oh, wait, yeah.
I'm a mental health professional in the community, and I work with kids and adults. And one thing I'm going to say really quick is that there's always going to be science backing up all directions, and I think we're all here to work with the people that we love, with our community. And one of the areas that I think is, so there's not a perfect fit for everybody. Some people can wear masks and do very well with that, and that's great. And in my opinion,
one of the contraindications to wearing a mask would be anxiety disorders in general, because we know that the arterial oxygen levels, the CO2 retention, those can be exacerbators of many anxiety-based disorders. Your profession is going to get this. It's already, you know, the shadow pandemic of despair and despondency, the suicides, the abuse, just the deaths, just from the economic shutdown. But there is a price to be paid in the health of our population when we are just, you know, expecting every individual to wear a mask. Some people with a lot of anxiety disorders, that mask on your face is, you know, is a mechanism of panic. It's a mechanism of anxiety, and I think we have to have some kind of an out for those people. There are medical conditions, there are mental health conditions that we should acknowledge, but you know what's going to make their anxiety worse is if they're one of those people that can't simply wear a mask and they're being looked at by other members of the population that like they're some kind of pariah, like they don't care and they don't want to protect their community. It's not about that, you know, it's not about that. But that's the division that's been created and the polarization that's been created that is going to have serious health repercussions. Yes, ma'am. And thank you for what you do, and God bless you, because you've got a lot of work ahead of you.
Yes.
Hey, since just to keep everybody's time and, you know, remind, this is kind of be the last question, then we'll kind of wrap things up.
All right.
I just want to say that I too am a medical provider in the community. I'm a family nurse practitioner, and right now my practice is primarily high-risk geriatric population. But I also serve in a COVID screening clinic, and I also serve in the urgent care rehab over the last 20 years, as well as out in the malformation that's been devastated. So I think it's easy to say that I don't have a dog in this fight. We all have dogs in this fight. You've got kids at school
Okay, finish.
You know, I can argue.
No, but you know, you're talking about science that has not been proven. You're talking about observational cohort study. Go ahead.
Okay, so we have this, we can argue this all night, you're right. I don't
She
wanna go
works
there.
at the hospital. There are 2 people in the hospital.
I work at the hospital too, there's 2 different hospitals. Okay, there's more than one hospital in this town.
2 out of 50,000.
There are more than, and there have been more than 2 cases, and there are more than 2 cases currently. I'll let it go with that. I'm not gonna be able to convince anyone, other than knowing what I am seeing in clinic, what I am seeing as a nurse of 20 years, as a nurse in rural medicine. I am here, I love my community, I love my mother, I love each of you. We all just need to take care of each other as best. And I agree, and all of these other scenarios, we have to figure out a way to work through. Because you're right, there's situations that make no sense to be wearing a mask in. But there's a lot of situations that do. And we should try and get our community masked up.
Well, okay, that's what I would call a fairly emotional argument that doesn't have a firm foundation in science. Let me tell you the emotional arguments in the 1990s were that Premarin, treatment for menopause was the first blockbuster drug in the history of medicine. And we undertook the Women's Health Initiative, one of the largest women's health studies to date. And it was a randomized controlled trial with multiple arms. That study was stopped midway through because we found that the blockbuster drug that everybody 50% of women over the age of 50 were taking was causing heart attack, stroke, and increased incidence of cancers. Randomized controlled trials are the gold standard science to which we should use to make our decisions. Not emotional arguments, not case controls, not anecdotes, not case reports going up, deaths going down. That's not how we make decisions in medicine. We make them on the best science that we have available at the time, and we always try to create better science. We don't stop at making a decision based on a retrospective observational study that I could say carrots cause COVID-19. That you can make those kind of studies say anything you want, folks. So the science that we should be relying upon is the science that we have right now. It's randomized controlled meta-analysis of influenza, and that tells us that we should not be masking the general population. Our public health authorities told us the same thing. When you mandate masks, if you make 80% of this population wear a mask, you're creating unfunded mandates that your people can't pay for. They're going to be reusing single-use masks. They're going to increase the transmission of disease. They may be rebreathing viral particles, increasing the severity of the disease. You could be doing that right now. You've been exposed, you may be asymptomatic, and you may be increasing your viral load. And what could be an asymptomatic disease could become a severe or deadly disease.
You're telling me to not to make claims that aren't science-backed, but you are making claims that aren't
Listen, it's all about viral load. Infectious disease experts will tell you the exact same thing. They are doing it all over this country. So that should not be an argument. If you want to argue against viral load and infectivity and rebreathing viral particles, then go give a COVID-19 patient mouth-to-mouth without your mask, because that you could be doing this. And tell me that that's okay, but because nobody's ever done mouth-to-mouth in COVID-19 patients, we should go ahead and do it until we know. I don't think that makes sense. That's not science. That's not using your medical training. And so I'm saying we should be using our medical training to evaluate the science at a very high level, and when we do, we'll make better decisions.
Yes.
But we're not getting the right information. We're not getting it from our public health experts. We're not getting it from our doctors and people that are working in these environments. They're emotionally bought into this because it's scared. They're scared.
Mm-hmm.
But
mainstream media is forcing this on us
it's
every time.
a lot of fear mongering. A lot of people are fearful right now. So I think we got to run out of time. I'll stay to answer any questions, but anybody that needs to go, please go, and I'll answer a few questions.
Yes, thank you. Thank you very much.
And I just want to close by saying, once again, thank everybody for spending an hour and a half with us here tonight on such short notice. I am proud to be in a community that cares this much, and there were a lot of people on Facebook Live today, not just people in this room. This has been a great event. I love the back and forth. Because honestly, even if you're on the fence on a mask mandate, or if you're on the fence of wearing a mask, or if you're on one side or the other. It's good to be able to listen to the different sides and, how each side feels, how each side thinks, and what's actually happening, and especially from healthcare officials on both sides. To me, it was a fantastic event. I'm so thankful for you to come, and I'm so thankful that you guys came as well to give your input. This makes it so much better, and that's what I love about this community is that, even in events like this, we can come together, opinions can be shared, and at the end of the day, there was no blood, there was nothing like that. So I would say this was a
Success.
productive conversation, and
Yes.
that is the reason that I agreed to co-host this event, because I thought it would be productive for our community, and it was a great thing for everyone to come out. So with that, I will let you get back to your families. Thank you so much, and have a fantastic evening.